So first we have to discuss about what is intermediate 1 and which is the expectation of life of patients with intermediate 1. We know that the main problem in patients with myelofibrosis in general are those belonging to the intermediate 2 and high-risk disease, with a median survival that is estimated to be 4 years for intermediate 2 and 2 years for high-risk patients. But as you can see in this slide, the median survival of patients belonging to intermediate 1 is around 8 years, and it is longer if these patients maintain the condition of intermediate 1 during the long term, as documented in the DIPSS prognostic model. But we know that we can use IPSS and DIPSS that are clinically based prognostic model, but we have an amount of information about cytogenetics and mutation analysis. And if you look at a patient with one of these cytogenetic profiles, so a complex karyotypes or SOL2 among these 8, 7, 5, 17, 11, 12 chromosome aberration, these patients have a very worse survival. So the median survival of this patient is around 2 years. And we have also the information of additional mutation that we can test with NGS technique. And this high molecular risk profiling means that one patient may have one among SXL1, SH2, SRSF2, and IDH1 and 2 mutations. If a patient presents one of these mutations, the median survival is 6.7 years. That is quite low. And among these additional mutation, the worst is SXL1. So if a patient presents with this combination, SXL1 positive, CALR negative, this patient have a median survival of 2.3 years. And so today, when we manage a patient with myelofibrosis, we have to keep in mind that we have not to consider only clinical parameters, but also cytogenetics and mutations.